The governor announced a new plan today to cut opioid deaths in the state by 50% in 5 years. The plan is part of the newly formed opioid task force's efforts to combat the epidemic in the state. Fox 47's Christiana Ford talked to a local recovery community about how this plan would impact those battling addiction.
Corey Warren has lived through opioid addiction.
It's a godsend that I'm still here.
Sober for 8 years now, he started the nonprofit Why I Am in 2013 and now runs Rise Recovery Community in downtown Lansing with his mom. They have 11 homes for people recovering from drug and alcohol abuse. So when he heard about the governor's bold new plan to combat the opioid epidemic.
It's a great initiative. I love it. I think everything that we're doing as a state right now is a step in the right direction.
The strategy, a $1 million media campaign to reduce the stigma of opioid addiction.
It's changing that criticism. The criticism of I'm an addict, I'm struggling with addiction, I'm addicted to heroin, right? So we tend to criticize somebody who does that, and we're trying to bring about that compassion, like she says.
The plan would add medicine-based treatment programs in 3 state prisons, expand needle exchange programs across the state, and eliminate the requirement that doctors get approval from the insurance company before starting treatment for addicts.
Reducing prior authorization is going to allow me to get access to life-sustaining medications for my patients. I know in the past I've lost patients to follow-up where they haven't come back to the office because I wasn't able to get medication in a timely manner. This would be game-changing for those individuals.
Warren says the changes show a move towards more compassion.
They're diseases, and we want to treat them as much as we can the same. And once we start breaking down that stigma, that person who was so scared to get honest about it might have a shot. They might be able to come forward and tell somebody I have a problem, and then that might turn into them getting help. And who knows, they might go to treatment, get out, and start a rise of their own and save people's lives.
And that was Christiana Ford reporting. Governor Whitmer says the opioid task force also plans to host town halls across the state in the coming months to hear directly from the community. The Michigan Department of Corrections plans to increase medication-assisted treatment programs to all its prisons by 2023. Michigan Health and Human Services says funding for the initiative comes from current state and federal resources and philanthropic dollars.